familias estén bien. Y que las familias estén bien significan niños felices, niños sanos. Y eso en un futuro es adultos sanos y un mundo mejor. Entonces, está bueno.
Hello and welcome everyone to the Public Health Media Day update. My name is Jean Cunnington, and today we're very happy to have Mendocino County Health Officer Dr. Andy Coren with us to give us the latest public health updates. We also have a special guest, Jonathan Escalante from Public Health Nursing. For today's schedule, we'll begin with Dr. Coren's presentation, followed by our guest speaker. After the presentations, we will go into the question and answer section with our local news media, as well as bringing in questions from the public on Facebook and YouTube live streams. This presentation is being recorded and will be posted on YouTube. So now, Dr. Coren, it's over to you.
Thank you very much. And hello, everybody, from the Mendocino Public Health Department for our monthly Media Day update. As Jean said, I'll give the infectious disease update, and then we'll have Jonathan Escalante from Public Health Foster Care Program. First, influenza levels are very low and have been, and it is the official end of the influenza season since April 30th. Mpox needs to be updated. You remember that the emergency ended several months ago. However, recently a cluster was found in Chicago and another one in France. Some had actually been fully vaccinated. There have been no deaths. This is a viral disease, usually self-limited, just for reminders. and it's passed by close and continuous skin contact, usually sexual contact, and it's usually mild, but sometimes can be painful, and it can cause other complications depending upon the location and also the severity of the disease. It is higher risk in those who are immune compromised, and it affects mostly people who are in the LGBTQ plus community. Since this is Pride season, we can expect more risk of contagion. So CDC and the California Department of Public Health have issued an alert, and people who are at high risk should try to limit their encounters. If you have symptoms of skin, mouth, or genital rash, either external or internal, you can see your providers for a diagnosis. There are other illnesses that can appear to be monkeypox and vice versa. So it's important to see a provider for the diagnosis. Access to vaccinations and treatment are being worked out at this time. I can't give that specific information right now. So moving on from that to the COVID report, you remember the federal COVID emergency ended on May 11th, 2023, a week ago. So there are some summaries of those changes today, and those have to do much of which has to do with coverage. So those people who are on Medicare, Medi-Cal managed care programs, vaccines, therapeutics, and testing will continue to be covered with no cost sharing. Medi-Cal fee-for-service, vaccines continue without a cost share. Therapeutics continue until September 30th, 2024, and diagnostic tests are covered, but over-the-counter tests vary depending upon the program. Medicare vaccines continue, but therapeutics and testing varies depending upon what program you're in. As far as commercial plans go, those that are regulated by California continue within the network without cost sharing until November of this year. It varies in plans depending upon whether you're in and out of network and some other issues. For those who are uninsured and have been receiving vaccines, therapeutics, and tests, that will continue to be supported through clinics like our federally qualified clinics and rural clinics until May 31st. That's just a couple of weeks away. But you may be able to enroll in the Medi-Cal through the Bridge program, and social services can help you with that. There are several changes of recommendations for healthcare providers and for congregate care facilities, they'll be addressed in a minute. COVID data is here on the slides, and I'll just summarize. The total deaths in Mendocino County is 145. That has not changed. There are no outbreaks currently. And for historical comparisons, I'm putting up these other numbers. They are less reliable due to changes in reporting, and we've gone over that several times in the past. Test positivity now is down to 4.6%, and that's down 0.9% from last week and less than the state's average at this point. Daily case average is 1.6 per 100,000, and that is again good, but it's not as reliable because there are fewer tests being done. So what are the more reliable indicators? At this point, we're changing over to COVID hospitalizations, and in Mendocino County, that's now on average 1, and that is significantly less than last month. Also, we're looking at a hospital burden, and that's reflected in the total numbers of COVID patients who are hospitalized, and that is low. And we would be more concerned if that got up between 5 and 10. We'd be more concerned about the risk in our community. Also new and coming will be reporting by the emergency rooms of their COVID visits and also total emergency room visits, which will be a good way to get an early alert of what's happening in the community. It's still a later alert than what we would like, but to replace some of the early alerts is wastewater surveillance. We now have 2 wastewater facilities in Mendocino County that are reporting. There is a 2 to 3 week delay because they average those numbers. This is now going to be on our dashboard as well. So in Mendocino, our level in wastewater surveillance is low and trending downward. Other nearby counties in rural Northern California, as well as in Sonoma, Napa, Marin, and Lake, are low and decreasing, as is the rest of the state. So our new community assessment is based on wastewater and the hospitalizations. And so we are now again at a low level. The forecast for the next few weeks, for the next month, is that it will be low, but it could possibly increase in early to mid-June. The forecasts, of course, get less reliable the further out we get. There have been some dashboard changes. We'll go over them now. With the end of the federal and state COVID public health emergencies, our dashboard is changing. We're going to be removing the COVID case counts and the community and transmission levels because they're less reliable. We'll continue to report on COVID hospitalizations, which now come from the CDC, since these are reliable and they may cue us when to consider masking up again. That's the advice you'll see on the CDC page you referred to from our dashboard. We are also adding a more timely and more reliable listing of wastewater surveillance data. Our dashboard will be updated less frequently, consistent with state and federal records which collect this information. And we will continue to report on local vaccination rates because this is an indicator of our community resilience. Next slide shows some about what's happening with variants. So the variant that's predominant at this point is still XBB 1.5, but it is declining in prevalence. In worldwide and the United States, XBB 1.9 and XBB 1.16, otherwise known in some social media as Arcturus variant, are most rapidly increasing, especially in India, but they're not increasing at levels that we would consider as we have for prior variants that really caused surges. And also in those areas where these variants have increased and become more prevalent, there's no increase in hospitalizations or deaths that are attributed to these. The other thing to note about the variants that are circulating now is that they are all sensitive to the bivalent vaccine and also to the treatments Paxlovid and what's used in the usually an inpatient as an injectable is remdesivir treatment. Paxlovid or Paxlovid, use does cut the hospitalization and deaths by 50%. That is 1,500 lives per week. These will be covered on Medi-Cal and Medicare plans through May of 2024. So let's go back now over vaccines. And there has not been very much change in the last month. For those under 50, it's less than 12% vaccinated on average. Those between 50 and 64 years old are vaccinated with bivalent vaccines, 28%, and over 65 is 50% have received these vaccines. We want to get those up. That is the best way to protect ourselves. And the recommendations now for vaccinations is anyone over 5 years old, regardless of the vaccine status, even if they've been unvaccinated, only need one bivalent vaccine to be fully vaccinated. Anyone between 6 months and 5 years may require anywhere between 1, 2, or 3 bivalent vaccines, depending upon the type of or the manufacturer, and also their age and prior doses. So I'm not going into the details on that. People should be checking with their providers. Anyone over 65 is now eligible for a second booster 4 months after they've had their last booster. And people who are immune compromised can get a second booster 2 months after their first booster, and they should check with their provider regarding eligibility for further boosters. Remember that these vaccines are available at most providers and clinics, as well as our public health clinics, and many pharmacies. They reduced the cases of severe illness, hospitalization, and death by 50%. And in most cases, as I said above, they're free depending upon your coverage. So protect yourselves and have fun this summer. New current CDC and CDPH recommendations are as follows. For new masking guidance, if you have respiratory symptoms, the CDC recommends wearing a mask around others. It's hard to distinguish between what's a cold and what's COVID, so protect the people around you. If you had a significant exposure to COVID, a COVID positive person, mask for 10 days around others, especially around others who may be at higher risk. And if you choose to wear a mask, pay attention to the fit and filtration. Choose those that are N95-like masks, and consider masking in indoor public transportation hubs and also other crowded indoor settings. So other recommendations, now we're looking at hospital admission levels. At all hospital admission levels, again, stay up to date with those COVID bivalent vaccines, maintain indoor ventilation improvements, avoid contact with people who have suspected or confirmed COVID-19 and crowds. If you're exposed to someone with COVID-19, consider testing. And if you're sick, stay home and get tested. Follow the recommendations for isolation if you have a suspected or confirmed COVID. And if you or a roommate are at higher risk of getting sick, talk to your healthcare provider about additional prevention actions, such as second bivalent boosters and masking. Now, at medium to high hospitalization levels, consider wearing a mask. And if you or a close social or household contact is at high risk, consider self-testing in addition. And at the high hospital admission levels, also the CDC recommends considering limiting indoor non-essential activities in public. And also note that there are many people who have a lot of anxiety, either because of their own long COVID symptoms or because they have lost loved ones, and people are still continuing to be very concerned about the emergence of COVID and their own illness. And so many of them are continuing to wear a mask. This is okay. Please respect them. Hopefully we'll get further and further away from this COVID pandemic and we'll all be able to relax some. So in summary, we're doing well after the emergency orders have ended. The CDC and CDPH have published recommendations to keep us safe. The most dependable, continuous advice is to get that bivalent booster. We have learned to protect ourselves with vaccines, using good judgment regarding masking and testing and staying home. And if and when a test is positive, using Paxlovid. Now we'll use this advice based on hospitalization levels as well, rather than the old community levels. So COVID is less of an immediate threat, but the variants are still emerging, and we have to keep vigilant to make sure we don't get into another surge type of situation. And with that, I'll turn it over to Jonathan, and afterwards we get some questions.
Great. Thank you, Dr. Coren. Jonathan, it's all yours.
Thank you. Hi, my name is Jonathan Escalante, and I will be speaking on immunizations as it applies to our pediatric population. Give me one moment as I start this slide again. Well, excuse me for one moment. I try to figure out what the issue is. So, as it applies to children, so I'm going to speak over what the CDPH spoke about: no shots, no records, no school, vaccine safety, number of vaccines, persistent infections, holistic medicine, COVID-19, and a summary. As a parent, you want to make the best decision to protect your children. staying
John,
informed.
you need to share your screen. Sorry to interrupt you.
It's not sharing.
No.
No, I didn't see it.
Hmm. So I'm having a technical difficulty,
Okay.
and I apologize.
I'll pull your presentation up. Why don't you go ahead and get started, and I will catch up with you.
Okay. As a parent, you want to make the best decision to protect your child. Staying informed will help you make important decisions that are reliable and make the correct choices so that you'll be able to keep your child safe. Um, so the CDPH, also known as the California Department of Public Health, has stated that children will only be enrolled if an immunization record is present and immunizations are up to date. This can be found on their website, shotsforschool.org, which will take you directly to their immunization branch on ca.gov. For children, toddler, kindergarten, and K through 12, schools are focusing on the DTaP, which is the diphtheria, tetanus, and pertussis. They're focusing on polio, hepatitis B, the MMR, which are measles, mumps, and rubella, and varicella, which is the chickenpox. Students starting the 7th grade, in addition to the vaccines I just mentioned, they're looking at the boosters for DTaP and varicella. So we're going to talk a little bit about vaccine safety. So vaccines are safe. Considering everything that we are exposed to and what we fight off daily, you will discover that the human body is incredible. The human body is exposed to various viruses, bacteria, and parasites. Many are harmless due to the effective immune system. But children's immune system aren't fully developed until the age of 7 and 8. Until they have reached that age of maturity, we have found and know of infections that can hurt our children. It is for this reason that we vaccinate to protect and prevent these diseases. Many children and adults are vaccinated yearly in the United States. We want healthy children in this county. We want healthy children in this state. We want our country to be as healthy as possible. Vaccines protect against preventable diseases. They reduce tremendously hospitalizations, disabilities, and even death. Vaccines are extensively tested and monitored by the Food and Drug Administration, or the FDA. Before vaccines go public, they are evaluated through clinical trials, where the FDA reviews safety and efficacy. Once a vaccine is determined safe by the FDA, it continues to be monitored by the Vaccine Adverse Events Reporting System, known as VAERS. Health and Human Services is what controls VAERS, and you can find it at the website vaers.hhs.gov. It does help track any health effects that happens hours, days, weeks, or months later. Anyone can report a possible side effect to that so that it can be studied. It is important to note, though, that VAERS is a reporting system, but not everything reported is necessarily associated with the vaccine. Researchers or vaccinologists look at the data and are monitoring to see if there is a rise in symptoms or a new side effect. Other organizations that support vaccines are the American Academy of Pediatrics, the National Academy of Medicine, and the World Health Organization. So, the number of vaccines. It took time to get where we are at today. Edward Jenner in 1796 was accredited for discovering the smallpox vaccine. He proved using the scientific method that when you expose people to cowpox, a lesser form of smallpox, they can effectively fight off smallpox. Now, when we talk about the scientific method, what he had was an observation. He came up with a theory, and then he tested his theory. He recorded the results, where others are able to reproduce and confirm whether those results are correct or not. And after doing so and seeing that they're true, we developed the vaccine. By 1940, we could better reproduce vaccines, and we were able to protect the public from smallpox, diphtheria, tetanus, and pertussis. By 1950, we discovered the polio vaccine, ending the iron lung and other neurological complications. By the 60s, measles, mumps, and rubella were created. And then 35 years ago, vaccines protected young children from only 7 diseases. And today we can protect them from at least 15 dangerous conditions, which all due to medical advances, excuse me. Many shots of the same vaccines are also boosters, and they give the children the best possible protection. Holistic medicine, persistent infections. Chickenpox, pertussis, which is also known as whooping cough, and measles are examples of persistent infections that both are circulating in the US and worldwide. Before the chickenpox vaccine was developed, the disease put more than 10,000 Americans in the hospital and caused more than 100 deaths each year. Children who get the chickenpox can get serious skin infections and pneumonia. In 2010, almost 10,000 Californians caught whooping cough. In 2014, over 11,000 people in California became ill and hundreds were hospitalized. Measles are another infection that remain common in many developing countries. Just before COVID-19 and the pandemic hit, that would be around 2018 and 2019, over 200,000 Europeans caught the measles. It just takes one unimmunized traveler to bring the disease home from another country. If immunization levels drop in our rare cases, in the US could quickly multiply, putting our children in danger. A good example of this is Disneyland in 2014 and 2015. Over 130 Californians caught the measles while visiting the theme park. Living through COVID gave us a better understanding of what happens when a virus is introduced to an unvaccinated population. We tried our best to isolate, protect, and wear a mask and wash our hands as often as possible. However, we became vulnerable, and if we don't give our immune system a head start, these things will arise again. Holistic medicine considers the whole person. Others may define holistic as natural medicine, using teas and herbs as an alternative to traditional medicine. Home remedies like chicken soup, high antioxidants like lemon and garlic have excellent health benefits. Unfortunately, we don't use these until we become ill. While there are no problems using these home remedies, only vaccines have been scientifically proven to protect against the flu, whooping cough, measles, and other preventable diseases that cause hospitalizations and death. Vaccines expose your body's natural immune system to a weakened or inactive part of the virus. In a sense, they are revving up your immune system to be ready for an exposure. So, when it comes to COVID-19, it is not required for schools to have the vaccine, but COVID-19 vaccinations are highly encouraged. COVID-19 has killed more than 1 million people, 1 million Americans, and millions worldwide. COVID-19 vaccines and boosters have shown to protect children. Over 31 million children have safely received the COVID-19 vaccine in the United States, and ongoing safety monitoring shows that COVID-19 vaccines continue to be safe for our children. COVID-19 vaccines and boosters provide the best protection for children against severe COVID-19 infections. So in conclusion, we just want the public to use reliable sources so that they can make good and proper decisions. A good resource that can help answer questions is shotsforschool.org. Shotsforschool.org is a good resource that can help answer questions such as vaccination timetables, what is required to enroll, how to catch up if your child is behind, conditional admissions, and exemptions. In addition to the resource provided by the state, parents can also check with their child's pediatrician or family doctor. They can guide you in which vaccines are appropriate for your child's safety and overall health. So we encourage you to check with your doctor and ask them for guidance if you cannot find the resources available to you. Thank you.
Thank you, Jonathan. Okay, we will begin our question and answer session. And our first question, just a reminder that we will be taking questions from media and from our Facebook and YouTube. And we will alternate questions with the media, and we'll try in public, and we will try to get in 4 to 5 questions. Make sure you ask one question at a time, and it's also okay to ask follow-up questions. So our first question for Dr. Coren, could you please elaborate as to why we need to continue updating our boosters? Some people are skeptical at this point.
Oh, that's a great question. So, as Jonathan was explaining, our immune systems are a fantastic machine. They need to be primed, and that's what we do when we give kids their first series of vaccines. And then, there's been a huge amount of research done on these vaccines and what is necessary to get the right levels. And that's why we went from one dose to then 2 doses, an extra booster, the 3rd dose, and then a 4th dose. And we find that with all vaccines, they affect the immune systems and the cells in the immune system a little bit differently. But the aim is to expose those immune fighting cells to some protein on these germs that they can attach to and then kill. And those cells that can attach to the viruses or bacteria, they don't stick around for life in the body, but the genetic material to reproduce those cells that are equipped to kill the viruses, the genetic material stays in cells that store it. And then when that germ enters the body again, it signals the body to produce more antibodies or more cells that kill that particular germ. So we don't know, and we didn't know for many, many years that it took, several boosters, several shots for polio and then boosters and so on and so forth. When I was starting out medicine, you needed 1 tetanus shot for the whole rest of your life. And now we're recommending it every 10 years. And that's just in the last 20 years that we figured it out. So for different germs and different vaccines, we need to do that. And it's just a reminder. It reminds the cells, oh, this is a bad, what we call antigen. This is a bad germ or an antigen. And we better perk up our sensibilities to it so we're prepared. So it just takes some time, and it depends on the body. And it takes a lot of research to figure out how many to give initially to start the body's process of producing antibodies or immune cells. And then you wait a while and you see, well, when do those antibodies decrease? And that's when we came out with, oh, you need a booster. And then we found out, sometime later that we needed another booster. And now we've got a schedule where we know pretty well what you need. Well, so many people in the United States have now been boosted against COVID that we can go with just the 1 bivalent vaccine. And the research shows that they're getting as much immunity as the old monovalent vaccines, which took 2 doses and then another booster to be what we called fully vaccinated. So our knowledge increases with time, and the more we use these, the more we understand how many boosters. I think this year, just from my own personal experience with these vaccines, over 50 years of practicing medicine, is we'll probably need some vaccines again this year and boosters, and it may be different this fall than even the bivalent vaccine. The FDA is going to be looking into that in the next month or so and deciding what should be manufactured. But after this year, we may find that you don't need another booster for 5 years. We don't know. And you may need a booster every year like we do with influenza. Because the other thing that happens is that the viruses change themselves. Rapidly multiplying viruses are not the same every year. And so the vaccines and the antibodies that they stimulate will not work against them. So those are some of the reasons that we need boosters.
This question, start with Jonathan. Would it be possible for a medical provider to grant an exemption for a vaccine if my child has a disability?
So that's something that you have to discuss with your medical provider. They're going to be able to better assess your child and find out what are the risks and benefits of not getting the vaccine or getting the vaccine. Um, it's really important in the sense that vaccines do protect your child from preventable diseases. And as I discussed earlier about what happened at Disneyland, that was unexpected. We vaccinate everybody for the measles. It's pretty common, and yet 100 and so many people got it at Disneyland due to traveling. So, and Mendocino is one of those counties that people like to travel through. And so, as much as we like to think that this will never happen here, I would have to say that we didn't think that COVID would reach here, and it reached through the whole country. And so I have to emphasize that vaccines are really important. But like I said before, that if you go to the website that I mentioned, Shots for School or shotsforschool.org, you will be able to see the forms, the exemptions, and you'll be able to discuss with your doctor what is better to protect your child and his health and safety or their health and safety.
Let me add something here. Being disabled does not necessarily impart a risk for vaccine. In fact, it's just the opposite. Being disabled in most cases creates a risk for the disease. And so your doctor can't just look and say, well, this is a disabled person, they shouldn't get vaccines. That would be an error, and it would be actually put the child at a higher risk. So it depends on the disease. And I think what Jonathan is saying, check with your provider. If you have a disabled child, then there's probably a provider that's associated and can answer your questions much more specifically.
Question, do I need a COVID booster if I'm planning to travel?
I'll take that. If you're planning to travel, you should pay attention to whether you need it. And your need is dependent upon when your last vaccine or booster was and your age and your immune competence. So those recommendations that I made are not dependent upon travel, but I would pay a lot of attention to those recommendations if you are traveling.
Great, thank you. Let's see. This one maybe for Jonathan and Dr. Coren. Have there been any changes in the immunization requirements for children? If so, is there a way to challenge this?
As I was discussing in my presentation, we have more vaccines because our medicine has advanced so much. We can protect your children for more things. And the first thing I think that is important is to educate what kind of vaccines exist out there. So we have attenuated and non-attenuated, meaning that we have a weakened form of the virus, which can be the influenza. We also have some that are non-attenuated, which are just proteins that are there to help get your body ready for an attack, to say. And so we use adjuvants to help kind of boost the little bit of material we have in the vaccines to cause your body to say, this doesn't belong here. And it uses its own immune system to grab it and kind of create antibodies for it. And now, of course, vaccines are a big concern for everybody. And we listen to that. And we listen to it not just as a county, but as a nation, in where we do lots of studies. And all our answers come back from studies that are proven from the Academy of Pediatrics and other sources to see what we can do to make sure the children are safe. And so, again, if you have any questions, I would say that you'd have to see your medical provider. Take one of the lists or pamphlets that are online, your doctor, and have a deeper discussion and talk to them why or why not you think that these things are you need more explanation for. But the reason why we're saying no shots, no school, is because we're trying to protect the entire community. And if one child is not vaccinated, then it becomes opportunistic in the sense that they can catch something and just spread it, even though everybody else is vaccinated. they can linger a lot longer, they can have complications, they can have pneumonia, and eventually there are some really nasty diseases that can even cause death.
Let me take a stab at this. Jonathan gave a great explanation for individual people, and if you want to challenge the necessity of a vaccine for yourself or your child, it's appropriate to raise that issue to your provider. But let me step back a minute and just say the purpose of scientific method in developing vaccines is to constantly be challenging the requirements. So VAERS is looking at a way or is looking to see if there are any safety challenges. And that's going on all the time. The United States, I think, is the only country, or certainly was the first country, who developed this nationwide vaccine adverse reporting system. And if anything shows up, any particular type of symptom that shows up that may be related in time or that anyone suspects is related to a recent vaccine, it gets put into the VAERS system by your provider, or individuals can put it in on themselves. And then the virologists and clinicians look at that and see, is there a connection to that? And then the other thing, I think people were exposed to this all during the COVID pandemic with the development of new shots, is they're always looking at what's the level of immunity, what's the efficacy. So the reason why we recommend vaccines is to prevent disease in a safe way. So we look at two basic issues. Are there any problems with safety here? That's the first thing that's looked at before it even goes to the next step of efficacy. And then after that passes, then we're looking at how much immune antibodies there are, how many immune cells there are, what are the numbers of illnesses. So whenever there's a new outbreak in a disease that should be done, like measles or chickenpox, the scientists are hot on seeing whether, was everybody vaccinated? If they were vaccinated, what went wrong? Is there a strain, for example, of chickenpox that has changed its response to vaccine immunity? So remember that, yes, you can challenge it with your individual provider. You can write into the California Department of Education requiring their recommendations, or the Department of Public Health requiring their. But remember that the scientists are looking and challenging this as part of the scientific method constantly. And that's why it's safe and they're effective.
Thank you, Jonathan and Dr. Coren. Our next question, I believe this is for COVID cases. This is probably for you, Dr. Coren. If the number of cases decreases, will schools still mandate that children receive the vaccine?
Oh, schools don't mandate that children receive the vaccine. It is not a mandate at this point. There was a concern, or there was a our governor said, well, by the next year, we may be making COVID vaccines a requirement. That has not happened. So it's not a requirement to go to school.
Great. Our next question, Dr. Coren, is the Public Health Department collaborating with local schools to prevent potential outbreaks? And by the way, thank you for your time and expertise.
Thank you for thanking me. Yes, we do work with the schools. At this point, it's mostly advisory, and I have a meeting with the schools. It's gone from every week almost to every 3 months now. But we talk about preventive measures and we talk about many things. But yes, we do collaborate with the schools, and the schools collaborate with us, and they've been doing a great job. They've had a huge amount of work to do. Remember, they were testing children and could hardly get to their curriculums. They were testing and checking and making sure people were not causing infections, and they did that. And remember, that also was a learning experience for all of us. How much did we need to do, and how much could we have let by? And when we were ignorant and we saw that there was, hundreds and thousands of people dying, and we couldn't be sure that it wouldn't also kill the little children, we had much stricter requirements. But we do work with them to find out if there are outbreaks, for example. Then we're working with them all the time on that.
Thank you. And then I believe this is our last question for the day. Can I get a different vaccine? My local clinic only offers Moderna, and I originally had the Pfizer.
Only if your clinic carries the Pfizer, but I would suggest that there's really no difference. For most of the other vaccines, you're not even given a choice, but because these are so new, they advertise and the companies advertise and so on. But yes, if you find another clinic, you can change over. If you had your original series of Pfizer and then now you want the booster of bivalent Moderna, you can switch. That's fine. There's no problem with that.
To make it a little personable, I myself to work in a hospital, you have to have your vaccines. So I have my vaccines, but I started with Moderna, and then out of convenience, I couldn't get an appointment, and I needed to get the vaccine. So I ended up going to Safeway, and they had Pfizer at that time. And just like Dr. Coren said, I said, well, it's the same thing. It's the same protection that I need, and you can do it. There's no difference, and I was able to get the vaccine in that way. So if your clinic is not providing it, and maybe it's due to an appointment, maybe you can't get a ride to that location, or other barriers, you can also try with your local pharmacy to see if there are other vaccines available there. So the goal is access, more important than anything. And we really don't want you to not take the vaccine because the parking lot was full or because you were unable to make an appointment, because that's one of the limitations of this county. We have a lot of people and very little providers, and those are real expectations and real problems that we run into. So, as Dr. Coren said, and I absolutely agree with him, there is no difference. If you got the Moderna, get it again. But if you run into a similar problem like myself, go to your local pharmacy and get the vaccine.
Let me add one more thing that I overlooked in my thinking in the first response. The littlest children, there is actually a difference between the Pfizer and the Moderna. And so you'll notice that for the smallest children, the primary series for Pfizer has been 3 doses and then followed by a booster. And for Moderna, it was 2 doses, a little separated, a little further apart, and then a booster. The differences are not that significant now that we've gone to bivalent, but there are still differences in the manufacturer's recommendations, and that's because they put different concentrations of the antigens in each vaccine. So in order to get the same immunity, the primary series should probably stay within the same manufacturer. That may change, but and it would not matter after 5 years old because there's only 1 dose necessary to be fully of the bivalent that's needed for the full vaccination. So for the littler kids, it's relatively more important to stick with with your primary series in the same manufacturer. It's not 100% necessary, but it's advisable.
Thank you, Dr. Coren and Jonathan, for answering the questions. That's all the questions we have today. Dr. Coren, would you like to give us a quick summary?
Sure. So I think we've come a long way. We've talked about the development of vaccines and a lot of knowledge on the part of the community, when to use masks, when to be more cautious in the community. We're following different indicators on our websites and so on. So we've come a long way. We're in a good place right now, but we still need to be vigilant. And if you are at higher vulnerability or a family member is more vulnerable, be a little more liberal about using those masks more often and stick with the N95s and make sure that they're fit pretty well. And if you are, at risk, then you want to consider, well, should I go to this public large event or do I want to stay back home? And when the hospital levels get to be higher, then all of us need to be thinking about that. But we've learned a lot in the last 3 years of dealing with this COVID, and we've come a long way. And hopefully, we won't see the same surges as we had in the first few years. But pay attention to the recommendations and use good sense and get your vaccines. Make sure you're up to date on the vaccines right now, because we're getting to be on top of this. We've learned an enormous amount more. They are safe and they are effective, so stick with that. And if you do get sick, mask up to protect others. And if you get sick and you test and it's COVID positive, make sure you're wearing the mask for a full 10 days and that you get the Paxlovid, which is an oral medicine. It should start early in the course of the disease, but it is very, very effective. And the only other thing I would like to wrap up is about the Mpox. Remember, Mpox has been discovered again in Chicago and in France. We don't have any evidence that these are outbreaks or that this is going to be a surge in the United States. But if you are at risk, then use the cautions that I talked about earlier, and you can look at them. You can look for them online. And if you've had only one of the Jynneos vaccines, you should get the second one, because that's really a 2-dose series to get fully vaccinated. Otherwise, everyone should have a great spring and summer. We're in a better place than we were for the last couple of years. And if you're outside in the same weather that I'm in, it's gorgeous. So enjoy.
Great. Thank you so much, Dr. Coren. I want to thank everyone who joined us today. And I just want a little reminder that we will be taking a summer break with Media Day. We're going to take a couple months off, regroup, and come back to you with even more and better information from public health. So I thank you, Dr. Coren. Thank you, Jonathan Escalante, for your presentations today. Thank everyone who listened and asked questions and who joined us on Facebook and YouTube. Thank you all for joining us, and you will hear from us in a couple months. And enjoy your summer. Bye, everyone.